One of the most common questions I get is, how can I deadlift with back pain? It hurts to bend forward, it hurts to bend backwards. Should I be deadlifting with back pain? Can I be deadlifting with back pain? What's up, everybody? My name's Dr. Michael Mash, and welcome to this week's episode of Whiteboard Wednesday. So before we get started, if you could please subscribe to this channel, that really helps us out and helps us get our message to more people. So today we're talking about how to deadlift with low back pain. And I'm going to give you 4 techniques or ideas for how to go about this. Back pain is one of the most common musculoskeletal issues. There's an 80% chance at some point in your life you're going to be dealing with it whether you lift or not. So for those people that are saying, well, lifting causes back pain, being human probably causes back pain when it really comes down to it. So I'm going to give you these 4 steps, and they're not in any particular order, but they're my 4 top ways to what to do if you have back pain and you're still looking to deadlift. So number 1, adjust your low back position. There's this idea that everybody needs to deadlift in a perfect neutral to slightly extended lumbar spine or low back, and that deadlifting with hyperextension or deadlifting in flexion is inherently bad or wrong for you. What it really comes down to is doing anything too fast, too quickly, with too much load and volume is probably not that good for you. So when it really comes down to it, when somebody has low back pain, it's usually back pain with certain positions. For example, sometimes people have back pain when they're flexed forward or they're in lumbar flexion. Other people have back pain when they bend backwards. If this is the case, you want to get that lumbar position or that low back position basically out of the symptomatic range, and that's where you're going to lock it into deadlift. Let's take it for somebody that has extension-based back pain. Okay, so it hurts to bend backwards. So for those folks, what you're going to do is you're going to actually encourage a little bit of visible lumbar flexion during the deadlift, because now they're going to be in a range of motion that's not sensitized. They're going to be outside of the symptomatic range of motion, and now they can deadlift essentially pain-free. So this is a case where I do allow for a little bit of visible, and I say visible lumbar flexion because we know that even to the coach's eye, when a coach says, oh, the low back's in neutral, there's still probably 20 degrees of lumbar flexion anyways. But what I'm talking about is if somebody has pain with extension, we can allow them to deadlift with a little bit of visible lumbar flexion because it'll allow them to get a tolerable training effect. The opposite, let's talk about somebody that has pain in a position of lumbar flexion. If that's the case, that's when you'll actually can cue, let's keep you as extended as possible to deadlift, because we're going to keep you out of that sensitized lumbar flexion range of motion and in a more comfortable position, which is visible lumbar extension. So you see that you can really manipulate the pelvis position or the low back position to find which positioning feels most tolerable for the client, and that's where you're going to have them locked and loaded. So adjust the low back position. Number 2, if you've watched any of my videos, read any of my blogs, or know anything about me or barbell rehab in general, you know that I'm a big proponent of it really comes down to the programming. So if you're dealing with back pain, you might need to temporarily decrease the load. If you're consistently training at high intensities or you're consistently training at high RPEs of 9 or above, no amount of form modification, manual therapy, recovery modalities is going to help. That's a load management issue. So if you're dealing with low back pain, you may need to drop the RPE significantly in order to get a tolerable training effect, and then you can follow it up with some sort of assistance work that doesn't bother your low back at all, and that's at a higher intensity. So for example, let's say you have low back pain and you're routinely training at RPE 8 or 9, and it hurts. But it doesn't hurt to do lifts at an RPE 6. So maybe now's the time to get your deadlifts in at an RPE 6 and then follow it up with some sort of maybe reverse lunge, 3 sets of 8 aside at RPE 8. This way, you can still train the movement pattern, the deadlift, in a tolerable fashion, despite it being at a lower intensity, but you're gonna follow it up with some sort of higher intensity exercise that you can tolerate, like a reverse lunge. Optimize the RPE. Number 3, try pause deadlifts. And when I'm talking about pause deadlifts, I'm talking about a deadlift where you pause for 2 seconds just below the kneecap. And this is going to work twofold. One, by doing pause deadlifts, you're going to get a similar training effect with much less load. So this is a way to make it feel harder, more difficult for you without having to use a high intensity. So it'll naturally be more tolerable. And 2, the fact that there's an isometric hold right below the knee in and of itself can be therapeutic, because we know that isometric holds have an analgesic or pain-reducing effect. So you get a nice 1-2 punch with pause deadlifts, because again, you get to use a lighter load to get a similar training stimulus, and you get the added benefit of a isometric hold. So try pause deadlifts. And one thing I really want to talk about, this might be a little like just like a golden nugget, avoid looking down at lockout. Okay, so for people with back pain, sometimes it comes with some sort of radicular symptoms or pain down the leg. Now, before you go thinking that it's okay to deadlift with pain shooting down your leg, it's not. That's something that you'd want to get checked out by a healthcare provider. But what I'm saying here is what can exacerbate this is when somebody goes into a lockout, if they go into a lockout and they do like a hard glute squeeze, which is going to promote a posterior tilt of the pelvis, more lumbar flexion, and they're also simultaneously looking down, you're now pulling on the nerves of the low back at both sides. This, for the physical therapists out there, you're basically doing a loaded slump test. So for people that have any kind of flexion intolerance or some sort of neural tightness or irritability, one thing you want to look out for is when the person comes up for lockout, make sure that their head is moving and it's not locking out looking straight down. I've seen a lot of issues where backs are flared up because people get into an aggressive posterior tilt and cervical flexion, and it yanks on those nerves that are already unhappy. So, how to deadlift with back pain? Adjust the low back position, right? Keep it in or out of flexion, extension, depending on what feels good. Optimize your RPE. Make sure you're not doing too much too fast too soon. Try pause deadlifts. It'll work from the isometric standpoint for pain reduction and allow you to get a good training effect at a lower intensity, and avoid looking down at lockout. Thanks for joining this week's Whiteboard Wednesday. I will see you next week.